cervical cancer. Actually, we have a lot of cases of pre-malignant condition in the cervix. I'm going to talk about that in a subsequent video, talking about the pap smear and the types of pre-malignant conditions and malignant conditions of the cervix. Now I'm going to talk about the invasive cervical cancer. Okay, it is the third most common gynecological cancer, the cervical cancer. Actually, it has a good prognosis in general. Even in advanced cases, it has a good prognosis. In the developed countries, because they have a screening programs for cervical cancer by pap smear, they discover the cervical cancer early. In the developing countries, they discover it in late stages. Okay, but though it still has good prognosis in general. Okay, the median age of cervical cancer is 45 and the average age is about 52. Okay, so it's a menopause disease like endometrial cancer, for example. Okay, so as I said, in developing countries, most of patients come in advanced stages. Why? Because we have no screening programs in developing countries. Okay, so in these countries is one of the most common killers. Okay, so what is the cause or the most common cause of death in cervical cancer? It is not this cancer itself, but it is the renal failure behind the cancer and uremia, okay, due to invasion of the bladder and the kidney sometimes. So this is the cause of death, and the most common cause of death in cervical cancer, the renal failure. Now let's move to the symptoms of cervical cancer. Actually, we have early symptoms of cervical cancer most patients present with, and the advanced symptoms of the cervical cancer, or the late symptoms. The most we may have usually asymptomatic cervical cancer. Okay, so in a lot of cases we have no symptoms. When we have symptoms, the most common among is the postcoital bleeding. Postcoital bleeding is the most common symptom, postcoital bleeding. Also, we may have other bleedings like intermenstrual bleeding, postmenopausal bleeding, menorrhagia. All types of bleeding could happen with cervical cancer, but the most common is postcoital bleeding. Excessive vaginal discharge, and actually the vaginal discharge in this case is watery and offensive. Why? Because it is the squamous necrosis products of the cervical cancer. So don't forget the postcoital bleeding, the excessive vaginal discharge, bleedings from other times, okay, or usually asymptomatic, so that in developing countries where they don't have screening tests, they discover the cervical cancer in advanced stages. These are the early symptoms of cervical cancer. What about the late or advanced symptoms? We may have hydronephrosis and renal failure, as I said. Okay, lymphedema. One of the way of spread of cervical cancer is by lymph metastasis. Okay, so lymphedema is one of the late symptoms of the advanced cervical cancer. Okay, lymphedema results in extremities pain and edema in some cases. Pelvic pain and pressure. Okay, mostly is not painful cervical cancer, but sometimes in the late stages may come with pelvic pain and pressure. Weight loss also in advanced stages. So in early stages, bleeding is the most common. Okay, in the advanced stages, lymphedema, hydronephrosis, the pelvic pain and pressure, the weight loss, and so on. So these are the symptoms of cervical cancer. What about the risk factors of cervical cancers? Let's start from the end. Okay, the cause of cervical cancer thought to be in most cases due to HPV infection, a human papilloma virus infection. Okay, especially the subtypes of 16, 18, most of cases, 70% of cases due to 16 and 18 HPV infection. Okay, in some cases due to 31, 45 subtypes. So you have to recall these subtypes. 16, 18, very important. Okay, 31 for 45 sometimes. 6 and 11 are responsible for the warts development, not cervical cancer, so benign condition. So HPV is thought to be the cause of most of cases of cervical cancer, because they discovered that presence in more than 90% of patients with cervical cancer. Okay, so studies were done to understand this. Whatever, the important thing here is all risk factors of cervical cancer is related not directly to the cervical cancer itself, but to HPV infection. Anything can predispose for HPV infection may cause cervical cancer, like early sexual relations, okay, below 18 sexual relationships, low socioeconomic states, okay, like in Africans, developing countries, oral contraceptive pills also will increase HPV infection, smoking and immunodeficiency. Immunodeficiency like in HIV. Actually in the past they used to call the cervical cancer HIV confined cancer, because it was associated with HIV in a lot of cases. Okay, so immunodeficiency, HIV, smoking, oral contraceptive pills, chlamydia infection, okay, multiple sexual partners or sex with partners that had sex with more than one partner, okay, and low hygiene. So I want just to make it easier, okay, these sexual things like early sexual relationships, like multiple sexual partners or sex with partners that had sex with more than one partner, okay, and low hygiene maybe, okay. Immunodeficiency things like smoking, immunodeficiency like HIV, okay, and the chlamydial infection. Okay, these are the risk factors of cervical cancer, but the causative factor is human papilloma virus infection. Human papilloma virus infection is a DNA virus. It invades the basement membrane and replicates there. Then this is the underlying pathology of cervical cancer. I want to just make sure that you never say family history is a risk factor for cervical cancer. Family history is a risk factor for all other gynecological cancers, okay? But cervical cancer will never be associated with family history of cervical cancer, except in cases of chance, okay, concordance. These are the risk factors, mind them well. Now let's move to the types of cervical cancer. The most common type of cervical cancer is squamous cell carcinoma, about 80% of cases. And the second type is squamous cell carcinoma is the most common. The adenocarcinoma is the second most common. The adenosquamous carcinoma, we have sarcomas, melanoma, they are very, very, very rare. Okay, so about 80% is squamous cell carcinoma, and other cases mostly are adenocarcinomas. Squamous cell carcinoma, the most common site to have cervical cancer is what we call transformational zone. And what is transformational zone? It is the area of metaplastic squamous epithelium. What does that mean? Let's show you that graph, okay? The outer or the ectocervix is conformed of squamous type cells, okay? And the endocervix is mostly of columnar glandular cells, okay? So the line that distinct between the squamous cells and the columnar cells is the squamocolumnar junction. Okay, the squamocolumnar junction. This is the squamocolumnar junction. Okay, this is the new squamocolumnar junction. The old one is that. Okay, so here we will have a squamous epithelium. Okay, this is at the beginning, and here we have columnar epithelium. Okay, by time this columnar epithelium here will be squamous epithelium. Okay, so the squamocolumnar junction, the old one, will move here, will move in that way. It will be more deep inside. Okay, the area between the old squamocolumnar junction and the new squamocolumnar junction, this area is a transformational zone, and it is the most common site to have cervical cancer. Okay, what type of cancer? Squamous cell carcinoma. And the transformation of, or the metaplasia of, the columnar epithelium into squamous epithelium is due to estrogen effects on puberty and other causes. Okay, I won't get into that. Okay, this is the type, these are the types of the cervical cancer and transformation zone. Thank you very much for watching. See you in the next video, talking about other issues of the cervical cancer, like diagnostic evaluation and diagnosis, staging, treatment. Okay, thank you.